The number of cases acquired through community transmission is increasing, and it's really important at this stage of the virus for us to maintain that level of control and containing it as much as possible. We want to see fewer people have to go to hospital. We want to see fewer people die. But we know, unfortunately, as has happened around the world, that the cases will continue to increase, and the more we can slow it down, the better it is for all of us and the more lives that we will save. I also want to, in particular, thank our frontline workers, whether it's our health workers, our teachers, our police, for really stepping up and keeping things going while we're going through these changes. And I also, in particular, want to emphasise to young people who've heeded the warnings, but today, as Dr Chant will say, we have had localised breakouts in areas like Waverly and Bondi, and as a result, Dr Chant will instruct all the medical professionals in that area to increase the level of testing, to increase the number of people tested in that community, to really reduce the community-to-community transmission. We know New South Wales has taken every strict measure we can to date to really control the spread. It's too early. I've read some speculation today about us bending the curve and what have you, but it's way too early to make that assessment. Whilst the number of cases have stabilised, there's a number of reasons for that. And what is of concern to all of us is that unknown, that level of community-to-community transmission that you might not pick up if people don't have the symptoms. And that's the real threat. People walking around without symptoms, not realising they have this disease. And that's why it's really important for everybody to assume they have it and to act like they have it. But I'm also very confident that we will get through this. Yes, it's been really hard to adjust. And for some people, the stress has been enormous. But please know that whether it's through federal government initiatives or through initiatives the state government is doing, that we are here to support you during this time. All of us are working together, all of us are coming together to support one another during this time. And if you have any questions or any concerns, please feel free to contact the 24-hour hotline we have in New South Wales, 13 77 88. We can provide information through Service New South Wales on any of the announcements that have been made which you might be eligible for, any issues you might want information on regarding the virus, or be referred to the relevant authority that can help you. Please know we are just a phone call away, and of course if you have access online, newsouthwales.gov.au is the address. But I want to thank everybody for stepping up. I want to please say to everybody, remain vigilant. Do not look at the case numbers on a daily basis. That's not the number to look at. What we need to consider is the community transmission that we might not even know about. That's the threat, the unknown threat of the community-to-community transmission we might not know about. And I want to in particular also thank New South Wales Police Commissioner Fuller for the wonderful work he and his officers have done in making sure we protect the community as much as possible. They don't want to have to issue on-the-spot fines to people. They don't want to have to issue fines to businesses or to people who aren't doing the right thing. But if they need to, they will. Because when lives are at stake, all of us have to accept that the world is different, and it will be different until this threat is gone. So thank you for everybody for stepping up, for agreeing to be part of us getting through this together. And please stick to the rules. This is serious. We're at a serious stage of the virus. And I want to thank the health authorities also, Dr Chan and her people, who've ensured not only through the testing regime we have in New South Wales, that knowledge, that information we have is really allowing us to contain the spread. I'm proud of the fact that we have done a lot of testing, and that has helped us identify where the threats are and to clamp down on them as much as possible.